I'm Dr. Yvette Lu. I'm a family doctor and I'm the host of House Call, which is a show about finding practical solutions for caregivers. We decided to do this show because caregivers experience a lot of challenges in their work caring for their care recipients. When I talk about caregivers, I'm not talking about paid caregivers. I'm talking about unpaid caregivers, family and friends who care for people with chronic illnesses, disabilities, and aging needs. As a family doctor, I see many of these caregivers come into my office with my patients, and I knew that this was an important topic that we needed to deal with. In our show, we meet caregivers and we interview them and we find out some of their challenges, and then we try to figure out a practical solution to one of their challenges. The work of caregivers is so valuable to our healthcare system. Replacing family caregivers with paid caregivers would cost $25 billion each year in Canada. Caregivers are really unsung heroes of our society. One of the important issues with caregiving and caregivers is that caregivers often don't self-identify. A study in the UK showed that over 50% of people took over a year to self-identify as caregivers. 25% of people took over 5 years to self-identify, and 9% of people took over 9 years to self-identify as caregivers. If you don't self-identify, if you don't realize you're a caregiver, then you can't access resources to help you in your caregiving. And this can cause increased negative effects of caregiving. Some of these negative effects are like social stresses, like social isolation, financial stress, physical stress from lifting, perhaps, or different other physical challenges of caregiving, and emotional stress. Between 20 to 40% of Canadian caregivers report depression, and 31% of British Columbia caregivers report that they are in caregiver distress. Our show is hosted on the Stories for Caregivers site. This is a website for caregivers. There are 3 new web series, including ours, on the site, and we encourage all caregivers to go onto the site and post their own experiences and their own stories of caregiving. We're hoping that caregivers on the site can connect to each other and build a caregiving community, and also that by watching other caregivers' stories on the site, that it will help them in their caregiving journey.